Welcome to the American Ambulance's Driving with Due Regard CE. During today's session, we will cover a few key points. First, we will define driving with due regard. Next, we will discuss understanding the importance of safe driving for EMS providers, and we will review accident statistics related to ambulance operation and explaining the significance of teamwork. Additionally, we will review our Code 3 driving policy and discuss that Code 3 is a privilege, not a right. Finally, we will delve into the potential legal consequences for driving without due regard. The term driving with due regard is a concept you encounter when you initially start learning how to operate under Code 3 conditions. It's a term covered in your new hire orientation and is likely to be emphasized by your field training officer. So what exactly does driving with due regard mean? Driving with due regard is the practice of operating a vehicle in a manner that strikes a balance between the need to respond swiftly to an emergency and the responsibility to ensure the safety of the EMS crew, other road users, and pedestrians. It's important to remember that we spend a majority of our day driving on the roadways, and driving with due regard should occur at all times. This means when we're driving to post, or to a call, or even to the hospitals. We have the responsibility to ourselves, our partners, the company, and the public for us to act in a safe and professional manner at all times while behind the wheel. For us to be able to help anyone, we have to make it there safely. This is one reason why driving with due regard is important, not only for the patients, but for ourselves. The primary reason why driving with due regard is so important is for the safety of all employees. Your safety is paramount. Code 3 driving can be hazardous enough due to the unpredictability of the drivers around us. Assuring that we drive with due regard can help to reduce the risk to our employees. Next is patient safety. Patients and their family trust that we will take care of them once they are in our possession. As medical professionals, we are responsible for doing our best in keeping the patient safe. Unsafe driving can be seen by all and can ruin the trust that we've established with our community. EMS providers have a legal responsibility to protect their patients and the public while transporting patients to medical facilities. This includes the duty to drive with due regard for the safety of all individuals involved. Driving with due regard refers to operating an emergency vehicle in a manner that prioritizes safety and minimizes the risk of harm to the patients, EMS personnel, and others on the roadway. And finally, professionalism. Professionalism in EMS centers on providing the highest level of care and ensuring the safety and well-being of patients. Driving with due regard is an essential part of this commitment. It demonstrates the provider's dedication to getting the patient to the hospital in a timely manner while minimizing the risk of further harm during transport. EMS professionals are entrusted with the responsibility of public safety. Operating emergency vehicles with due regard shows respect for the safety of other roadway users and pedestrians. It helps maintain the public's trust in EMS providers and their ability to respond to emergencies responsibly. Driving Code 3 can possess several inherent dangers, both for the emergency medical personnel inside the ambulance and for other roadway users. Due to the high rate of speed during an emergency response, we are at risk for being involved in an accident. Each year, there are an average of 6,500 accidents that involve ambulances throughout the country. 35% of these accidents result in injury or fatality to at least one or more of the occupants involved in the vehicle. Each year in the United States, there are an average of 29 fatal ambulance accidents, which produce an average of 33 fatalities. Ambulance accident statistics involving high rates of speed are a concerning aspect of emergency medical services. While ambulances play a crucial role in rapidly responding to life-threatening situations, the urgency of the task must be balanced with the safety considerations. High-speed ambulance operation can lead to a higher risk of accidents, which not only endanger the lives of the patients, EMS personnel, and the public, but can also result in legal and financial liabilities of the EMS organization. Most accidents involving ambulances are typically due to their high rates of speed in which they travel. Though ambulance accidents are significantly less than that of law enforcement, they can be more catastrophic due to the patient being on board. According to the National Safety Council, in 2021, there were 39 deaths associated with ambulance accidents. When operating an ambulance, it's a team effort. You have the driver, who operates the vehicle, and you have the passenger, who is consistently looking for roadway hazards. When we're driving, we always want to make sure that we are consistently scanning, looking left, looking right, while we utilize our mirrors. Doing this will help us be familiar with our surroundings and will allow us to make an evasive maneuver without making contact with any other vehicles around us. Within our standard operating procedures, it designates responsibility for each crew member when operating an ambulance Code 3. For the driver, your responsibility is to keep both hands on the steering wheel, always maintain safe speed and following distances, make sure that we are always traveling in the appropriate lane, and continuously observing for roadway hazards. For the passenger, your responsibility is to determine the most appropriate route of travel. This means that you should be the only one who views the map, and you will give the direction to the driver. Additionally, you will maintain all radio communication with the dispatch center, assist in scanning and identifying hazards, and change warning sounds as needed. American Ambulance has established policies and procedures pertaining to Code 3 driving and navigating a controlled intersection. These are found in our standard operating procedures. As professionals, it is our responsibility to know and understand these policies. Here are some key points to remember. We should always maintain a sterile cockpit. A sterile cockpit is an aviation term that requires the flight crew to refrain from non-essential activities while the aircraft is involved in a critical task. Operating an ambulance in a Code 3 status is a critical task. We should refrain from any non-essential activities such as texting or talking on the phone while we are traveling Code 3. Next, it is important that we ensure that all of our emergency lights are activated. At times, we can inadvertently go en route to a call without activating our lights. The use of only the siren can cause confusion for other drivers on the roadway. This can be a contributing factor to a collision with another vehicle. Utilize only the approved siren modes as part of your request for the public to yield the right-of-way to you. American Ambulance allows the use of the wail, yelp, and short bursts of the siren. The air horn is prohibited. It's important for us to remember that when traveling Code 3, we are only allowed to travel 15 miles an hour over the posted speed limit. This maximum speed limit is set for your safety and shall not be exceeded. It's important that you operate the ambulance in a controlled manner, allowing you enough time to make an evasive maneuver in the event of an emergency. Remember that we should always try to avoid passing on the right. Drivers are required to move to the right when yielding to an emergency vehicle. By passing on the right, this can increase our chances of a collision. Opposing traffic should be used as a last resort and only if absolutely necessary. It's imperative that you use extreme caution when doing so. When driving Code 3 and approaching a controlled intersection, you must remember to come to a complete stop before entering the intersection. Make sure that we look left, right, left again before proceeding, and treat each lane as its own intersections when vehicles are present. This means coming to a complete stop prior to proceeding through each lane. Before proceeding through any intersection, make sure it is absolutely clear. Do not enter the intersection if you are uncertain if any vehicles are yielding the right-of-way to the ambulance. At times, we may assume that vehicles see us. However, they may not, and that's when collisions occur. Driving Code 3 is a privilege, not a right. When we turn on our lights, we are asking the public to grant us the right-of-way. It is our responsibility to make sure that everyone on the roadway is safe as we proceed with caution. Failing to drive with due regard can put us in jeopardy of litigation, not only for the company, but for the driver of the ambulance. That means it is our responsibility to follow all the roadway laws and drive with due regard at all times. In certain instances, ambulance operators have faced legal charges and been prosecuted for operating ambulances negligently. It is crucial to operate ambulances with the utmost care to avoid any allegations of negligence. This concludes our CE on driving with due regard. Thanks for all that you do, and stay safe out there.